And then don't forget about the record.
Yes, the record, right. Okay, so you're correct.
Yeah.
This gentleman has set a new record here in my career of pulling herniated discs out. And if you go back and watch the video, I was lasering and I was talking about how, and you're gonna see the video, how the herniation just kept coming down and down, and I would laser it and come down and to laser it. And then finally I could see a piece of the big piece, and I went in there with the grabber and pulled it right out. And look at this video. We got a new record right here.
Yeah,
so it's pretty cool.
Up and inspect. There's a herniation right there. Look at that. Bam. That was awesome. That's it. Let's turn the light and show these people. Stop gawking.
That is huge.
Okay, this is the herniation right there. You don't often get it. But that's it. Yeah, that looks like a baby. Give it an APGAR score, please.
Dr. Huge Herniation here on November 5th, 2021 with a visitor from out of state who came to Florida from Minnesota with his family. I met his lovely family yesterday, his son and daughter and wife, and they were waiting for him because he had surgery done here at Deuk Spine Institute, didn't you?
Yes.
Yeah. So you didn't come for Mickey Mouse?
No, I did not.
What brought you to Florida?
The Deuk Laserspine Institute, if that's what it's officially called. But yep.
Good enough for me.
Yeah, excellent. Excellent.
So why would you come to the Deuk Spine Institute and not Disneyland?
Because you're doing something that I couldn't find anybody else doing in the United States, so I needed the back surgery.
Yeah, you're correct. There's nobody else doing it. And what kind of problems were you having with your back before surgery yesterday?
Intense pain down the left leg, intense pain in the middle of the leg. I couldn't sit, I couldn't walk much, I couldn't drive for the last 3 months. So yeah, it was pretty bad.
Now I noticed you've had back surgery before.
Yeah.
You had a microdiscectomy?
Yep.
How did that go for you?
It went okay. It improved. That was in 2009. Improved the pain somewhat, but it didn't help the back pain. And I feel like I probably had some trouble with the other disc. So I was so glad that you were working on 2 discs at the same time. So that was, so yeah, it helped, but not nearly like this surgery, I would say.
Yeah, microdiscectomy is an older type of surgery. Unfortunately, it involves removing normal bones and joints and ligaments. So it kind of weakens the spine, and then you come back with another herniation later on. Microdiscectomy also doesn't fix back pain. All it does is treat leg symptoms. And our goal here with the surgery was to cure back pain and leg pain.
Yeah.
So how do we do?
Fantastic. I mean, I slept good last night. I can sit in chairs. I can walk around. I got in the car. Yesterday, I couldn't even sit in the chair in the waiting room. I laid on the ground. I was fine sitting, so that's nothing short of a miracle.
So the back pain you came to Florida with, is it still there or is it gone?
It's gone.
Back pain's gone. Leg pain that you came to Florida with, still there or gone?
Gone.
So back and leg pain are gone, cured. Do we have you on these powerful narcotic pain meds after surgery?
Nope.
No. You're not taking any pain meds, are you?
No.
Yep. So no pain medication, 1 day after surgery, not even a full day, what, 12 hours?
Yeah.
You were the last surgery, right?
Yes.
Yeah, we saved the best for last, of course. And now your pain is gone. Your family's happy, I imagine?
Yes, absolutely.
Yeah. I told your son and daughter they need to take care of you.
Okay.
Yeah. I said, look, Dad's going to go through recovery and you guys have to baby Dad, okay?
Yep. I like that.
Your son said to me, when can Dad go in the pool?
Yeah.
I know you're staying at a house with a pool.
Yes.
And I said, well, he could probably go in the pool on Sunday.
Perfect.
So 3 days after surgery.
Yep.
Anything else you want to tell your audience?
No, it's fantastic. And for Don on the Facebook group, thanks for recommending this guy. He was here a couple months ago, so it goes by DM Maker, I think.
All right. Safe travels back home.
Yep. Thank you so much.
You're welcome.
Much appreciated.
My
all
pleasure.
you and all the staff. Fantastic.
Yeah, you're welcome.
Yep.
You're welcome.